And this is just a list of typical things you might do for a patient, because I went through that whole long bit of management there. So we tell the patient, avoid polluted or allergenic environments there, eat well, sleep great, correct your hormones, clear out the gut, take digestive enzymes, use appropriate vitamins as listed there, and use immune boosters, thinking about the infectious component. Now, you may have family members that don't have fibromyalgia, and you might think, well, how could we help a person avoid getting one of these syndromes? And these are just a few thoughts on that. Live and work in clean environments. Eat clean, nutritious food and drink pure water. Maintain good mental health. Be happy. Have a spirituality that is solid and truth-based, and get regular exercise. My clinical practice style, I'll just make a few comments about it, and we are coming around the corner here. Timekeeper, yeah. We're going to make it, I think. Stretch that tape, okay?
I'd rather you went on longer.
Oh, all right, I'll talk slower. Valerie's already asleep, so yeah.
I have my eyes open.
Okay.
This is my fatigue.
The various components of diagnosis and management must be combined in a particular way. We talk about the art and science of medicine. And one of the things that people forget is that there is the art of science. And by that I mean thinking about thyroid, for example, or thinking about the bell-shaped curve and working the border line of the bell-shaped curve. That balance between the psychological, the spiritual, the physical, the environmental. There's an art. There's many variables, and you're having to work with them all at the same time, making judgments and so on. And trying to be loving and encouraging along the way. In nutrition, I've made a note, there's 2 standard deviations and quintiles. One of the labs we use a lot is, will express the laboratory reports for nutrition, not just in the 95th percentile, the bell-shaped curve, but in quintiles, the 80th percentile. And the reason is because many nutrients work together. And in linear medicine, you want to have that very strict definition of being abnormal. In nutritional medicine, you want to be a little bit looser there, because the combination may give you a benefit that if you went strictly by the 95th percentile, you'd miss that benefit. Integrative medicine is part of my clinical style there, because we want to get the best of every discipline. We try to tell people the truth. We don't like to give false hope, but we want to be hopeful as well. And we want to love our people and teach them to love others. I teach people to be, particularly with the environments, I teach them to be prudent and not paranoid. Sometimes you start talking about perfumes and colognes and new carpeting, and people freak out. You know, they go to work and there's a new employee there, you know, and everybody else stopped using perfume, and this new lady or whatever, you know, man, cologne, and you can just reek. You just see it coming off, you know, just heavy, heavy. And so you want to prudent, not paranoid. And so prudent means you want to take the necessary steps, keep calm, not be paranoid, because it doesn't help. Priorities. Sometimes people get on tangents, you know, keep them back on the track. What's most important there? I encourage modest expectations while hoping for the very best. Now, there is a psychological factor. I made kind of sport of the whole issue of it's all in your head and so on like that, but there is a time to think about psychological factors very clearly, because sometimes it's the primary issue going on, the primary issue. We always consider the psychological factors, the social, spiritual factors in the office, and we talk about it openly. So I used to, kind of the way I was trained, I guess, you know, you sort of talked about physical things, you know, and your blood pressure and your, but if it was psychology, you kind of pussyfooted around it. And I'm very, sometimes I can't sort people out, you know. I say, look, you know, there may be psychological factors I can't see and you can't see. Let's just kind of look at here and put them on the table and work with them. And we don't want to be helping people hide in a physical illness, hide a long-term psychological problem. We don't want them to hide in a physical illness construct, the language of disease, because that's not helpful over the long term. Common psychological findings we have are grief, anxiety, depression, being overwhelmed, and sometimes violated. Sometimes violated. I think they're about psychological trauma, but sometimes environmental trauma. I had one fellow who worked in an office with a mold problem, and we went through court cases with him and stuff, and the word that one of the attorneys used that just hit it on the head. He said, he feels violated. That says it. You know. He was hurt, and he's done much better. Environmental cleanup. Let's see, masking of symptoms with the medication will not break the vicious cycle of inflammation over the long term. We've got to look for ways to get rid of pesticides, solvents, chemical fragrances, dust, molds, and mycotoxins. Detoxification, that word you've heard, is cleaning up the internal environment. Why do some people never get sick? Well, there are many variables again. The genetics, the hormones, the intensity of the exposure, and again, the high or the low, sometimes the low is the worst, the duration of the stressor, other nutritional deficiencies, the current balance in your immune system. You may have read about the Th1, Th2. Where that's at can impact how you respond. Detox capacity, diet sensitivity, all of these things here. Some people don't get sick. They could live in bat caves eating Cheetos and do well. Who's most likely to succeed? Well, the person most likely to succeed in improving their health is the person who starts soon, who wants to get well, who's committed to doing everything possible, who has some extra financial resources beyond basic insurance, and I should say doesn't depend on insurance like a child to fix all my problems, has a support team, has assistance from an employer with accommodation needs. They've embraced the size and the challenge of fibromyalgia. Some people come and they want to do just one little thing. I've given a pretty big picture here. And if you come to my office, we talk about these things, and I tell people, we're not going to deal with this the first time. We're putting the cards on the table here. Take a big, but you have to embrace the whole problem there. And then include all the components of getting well and do that consistently. We are not wistfully looking for a quick fix or a magic bullet if we're going to succeed. How can the average clinician take an environmental perspective, think integrative, organic, multifactorial, multi-system, ask specifically about reactions to inhalants, chemicals, foods, buildings, and variations in the weather, ask about both chronic low level as well as acute high exposures to molds, pesticides, and chemicals. If anybody's interested, if any of you are clinicians here, AAEMonline.org is my professional organization, and that's a good place to go. There's also patient resources on there too. AAEM, American Academy of Environmental Medicine Online.org. Summary, recovery is a possibility, but not an entitlement. So take charge of your health. The best chances for recovery comes with the use of integrative approaches. Expand your thinking to include the new environmental medicine paradigm. Clean up your environment. Sometimes you can't control everything out there. Take care of what you can. And if you're a clinician, keep asking why. Thank you.